Hi, I'm Dr. Loftus. I'm an anesthesiologist and critical care physician here at Dartmouth Hitchcock Medical Center.
My name is Matthew Koff. I'm an anesthesia and critical care physician, also at Dartmouth Hitchcock Medical Center.
So Matt and I are happy to participate in this conference because for quite some time now we've been interested in healthcare-associated infections and better understanding how bacterial transmission events occur so that we can better understand bacterial cross-contamination, which is, we all know, the underlying mechanism of HCAI development. And the first hospital setting that we decided to study this process was the OR environment. And initially what we found is that the operative environment is heavily contaminated with bacterial organisms. We developed an experimental model to study bacterial transmission events within that environment, and ultimately from that we were able to identify risk factors for this transmission of both potential and true bacterial pathogens. And the next obvious step, once identifying risk factors, was to deploy various interventions to reduce that transmission and hopefully reduce healthcare-associated infections. And so one of the first risk factors that we identified is consistent with the work of Dr. Pate and other infectious disease or infection control specialists, which that the hands truly are an important component in terms of bacterial contamination of provider hands, specifically plays a role in overall intraoperative bacterial transmission. And from this information, we then use a targeted approach to reduce intraoperative bacterial transmission, and have found that by reducing transmission events, by improving hand hygiene in the intraoperative setting, you can actually reduce perioperative healthcare associated infections significantly. So it's been a long process of identifying intraoperative transmission events, identifying risk factors for these events, and ultimately deploying key interventional strategies to target these risk factors that has led to some very important work in the intraoperative setting in terms of reducing healthcare associated infections.
And I'd just like to add, it's an honor to be here today and to be involved with this with Dr. Pate and trying to get the word out on the importance of hand hygiene really in the healthcare setting. And just to add what Dr. Loftus had talked about is, what drew us here initially was identifying areas of contamination in our work environment. The interesting thing was, at the beginning we didn't actually target hand hygiene, but the data actually pointed us in that direction. So the areas that we work in, the areas that are heavily manipulated by our hands, were the highest contaminated areas in our work environment. And so from there, it was obvious that we had to target hand hygiene. And so, looking around, we actually were able to identify, I guess the Sprix device was nice for us in that it was able to record and give us feedback on how well people were doing. And so we had some measure where we could actually show either an increase in provider ability to utilize and wash their hands during an operative case. And so with that data, we were able to show a significant reduction in contamination to patients' IV tubing, and ultimately, potentially, a reduction in morbidity and post-op infection rates. From this, we also felt that this data was important that we could apply to other healthcare settings. And so in the interim, we've actually we've completed an ICU study where we also deployed these devices, and this, basically it's a system, an educational system based on Pate's work, Dr. Pate's work, and so we were able to show, which is currently being submitted for publication, but we were able to show a significant reduction in ventilator-associated pneumonias in our intensive care unit over a year period. So again, we feel very honored to be here and feel that this is a very important subject matter that we have to help, and we're looking towards helping change and improve practice throughout the healthcare setting. So thanks for having us here today.